Assalamu alaikum. I'm Dr. Rowshon Ara Begum, Assistant Professor, Department of Forensic Medicine and Toxicology. Today, our topic of discussion is clinical forensic medicine. So let's start. Medicine and law were weaved from the earliest period of time, perhaps from the perceiving necessity of protecting the community from the irresponsible acts of unqualified medical practitioner or quacks, or any other issues other than the medical practitioners concerning to avail the justice to the common people. From this interaction between these two professionals, that the medicine and the law, emerges the specialist discipline and later the academic subject forensic medicine. The other names of forensic medicine are state medicine or legal medicine. Now, when the term forensic medicine comes to our concern, it is defined as the science that is concerned with the application of the principle and knowledge of medicine to certain branches of both civil and criminal cases to aid in the administration of justice. So in short, it deals with the medical aspect of law. There are two broader aspects of forensic medicine that has two distinct aspects of law and medicine relationship. These are the forensic pathology and clinical forensic medicine. These are essentially different subjects but are closely related in practical facts. In definition of forensic pathology, it is a branch of forensic medicine dealing with the medico-legal investigation of deaths such as sudden, unexplained, unnatural, suspicious and violent deaths. A complete autopsy is required in most of the cases to determine the cause of the death, manner of the death, time since death or even other facts. But poor autopsy is worse than any other no autopsy at all, as it is more likely to lead to miscarriage of justice. Now comes the clinical forensic medicine. It is a medical specialty which deals with interaction of clinical medicine and forensic medicine. It is principally concerned with the provision of clinical services as well as the medical advice, investigation of violent crimes and other offences. Examination of a living person for medico-legal persons or purposes are termed as clinical forensic medicine. There are a broad spectrum of scopes for identifying the clinical forensic medicine subjects, that are the physical assault victims such as the assault cases like as domestic or any other roadside any conflict or other facts requiring the injury certificate. Sexual assault victim involving all sorts of sexual offences, that are the natural offence, unnatural offence, sexual perversions as well as the sex-linked offences. Accidental cases also involving the mass disaster investigation, which requiring the identification of the deceased persons, more than 12 persons. Drunkenness cases, poisoning cases, disputed paternity, even disputed maternity cases, age determination of a person, whether an infant to adult elderly cases. Identification of the mutilated bodies or skeletal remains remain on the domains of deserted areas, or extortion cases like unlawful or wrongful act requiring the threat or force, or even theft cases. There are certain legal and ethical aspects of clinical forensic medicine. First of all is the requisition from the legal authority. Here comes the legal authority, that are the court or the police itself, requiring the requisition, that is the request form to inquiry and involving the examination of these medical legal cases. Further is the identification of the victim. The identification of the victim is a major point where we can identify the person as a victim to further cases in future. The consent, a major part plays here. Presence of third person, female adult attendants or even a nurse who will play the neutral role in this whole process. Medical confidentiality is must, that is termed as professional secrecy, an ethical concern on this part. This consent is termed as informed written consent, where the examination of the victim or the patient should not be made without his or her permission or the parent or guardians when the person is underage, and this consent must be written form either in a signature form or as a thumb impression. And this consent must be well informed about the consequences, about the procedure, about the acts will be done, about involving the private parts examinations as well, the further informations as this consent containing the opinions in further consequences like within his or her favor or except others. The consent must be free, willful, voluntary, without any fear or threat, or even without any other influence of drug. And also this consent must be in under sound state of mind. Now comes the examination procedure. This examination procedure of this clinical forensic pathology, including the history taking as the whole concept, general physical examination involving the external examination as well as the internal examination, examination of the special area that commonly inquires the local area or the private parts examination. Then comes the referral system, referral to the required domains for further evaluation of the respective facts. This referral can be done to the specialist of requiring the fact, the radiology department, the pathology department, clinical, that is the toxicological analysis, also termed as chemical analysis lab, and further finally, most importantly, forensic DNA profiling lab. All this requiring will be done after this opinion regarding the respective cases. Here comes now the collection, preservation, labeling and transmission of the specimens. The specimens that is received from the area of crime or area of the conduct is termed as the trace evidence. It is important to maintain a chain of continuity or a chain of custody of any physical evidences collected from the site or the examination of the victim. That may including the clothing, the mud or any other traces, any blood stain or seminal stain, any blood sample can be required, bite mark, pubic hair or any swab requiring the vaginal swab, buccal swab, anal swab, etc. Now comes the clinical forensic medicine services. These services are provided all the government medical colleges or forensic department. Forensic medicine department as we termed as the emergency department of all medical college and hospital, district hospital level, also Upazila hospital level, and specifically OCC, that is the one-stop crisis center situated in most of the district hospitals and medical colleges. Now comes the vital role playing DNA profiling service. It is the major role played on OCC as well as the samples of this DNA is sent to the National Forensic DNA Profiling Laboratory situated at Dhaka Medical College campus. The divisional screening laboratory is also in the Rowshon Medical College, Chittagong Medical College, Sylhet Osmani Medical College, Khulna Medical College, also Borishal Medical College, that is Sherebangla Medical College. All these services are included in clinical forensic medicine to involving the cases requiring as the extortion case, poisoning case, drunkenness cases, also the assault cases, whether it is physical assault as well as the criminal assault, sexual assault, also the paternity tests, whether the paternity or maternity tests. That's all for today. Thank you. Assalamu alaikum.